and with me here today is Dr. Jaswant Patil, Dr. Rajeshwari Rapata, and Dr. Martine Jus. I'm very happy to have all of you here. I'm very glad that we can share the knowledge and discuss deeply on what we can do with our favorite viral disease of the year. And my dear colleagues, may I ask you to introduce yourself because you can do it better than me. Who wants to start?
Hello, I am Dr. Jaswant Patil. I am a pulmonologist from Allopathy. After practicing 12 years of allopathic practice, I noticed that in my mother's time, when that was a checkmate with the all over septicemia with multi-organ failures, she was on the last where all the treatments in allopathy were over, and I was knowing after being an intensivist for 5 years, there was no other way out, and I was just waiting for her to die peacefully. And that time, one of my friend had given me a book of Kent's Materia Medica, but I never used to believe homeopathy because I was a staunch and hardcore allopath. But when the time had come to me, and then I said, oh, I'm in a checkmate position. So, can any other sciences let us test whether they can save my mother in such a bad state? And fortunately, I saw the book was lying in my shelf. I opened the book. It was Ars Iode, which was matching the exact clinical condition of the mother. And one dose of Ars Iode gave a very beautiful relief. And then I changed over to homeopathy, became passionate in homeopathy. And then I took admission into a regular BHMS college to get a degree so that I can practice legally. And I completed my homeopathy. And after, with the experience of my own nursing home as an intensivist for 5 years in different hospitals, working in general medicine, hematology, respiratory medicine, general medicine, and kidney cardiology, doing angiographies, angioplasties, and the world has shifted to homeopathy. And now I have decided that every science has got limitations, and we must do something to integrate all the sciences, because when I got a checkmate in allopathy, I went to homeopathy. Even all the sciences have got limitations, scope and limitations are there. So we take up the scope, and where the limitation comes, tide over the crisis to go to another, so that the integrative approach would be the best to the world today. Thank you. It's all about me.
Thank you.
Thank you.
Who wants to continue?
Yeah, the other members need to be introduced to the viewers. So I pass over to Dr. Martine.
Okay. Thank you. Thank you very much. I'm also a convert, but I was first a veterinarian. I was first a vet. And then before I met my husband, Dr. Martine Jus, and he taught me everything about homeopathy. And I converted completely. And I treat only humans. I don't make veterinary homeopathy anymore. And I built up the SHI Homeopathic College and Center in Switzerland with him in the last past 30 years. It's a center, really a unique center for Europe, where you have everything it's a private center without really everything private, but we have a college. We have a college with a program for humans, human homeopathy, normal homeopathy, and a program for veterinary homeopathy. Then we have a clinic. We are 9 homeopaths in the clinic and 24 hours emergency service. It's quite a big OPD, let's say, and practice. And we have also a pharmacy. And we have also a library and a beautiful homeopathy garden. The concept we had, and we make also research, we have research programs. So our concept is that everything, homeopathy should have a home. That's why it's called House der Homeopathie, House of Homeopathy, etc. So that's what I did with my husband for the past 30 years. Unfortunately, he passed last year unexpectedly, and so I'm continuing his mission, which became my mission, and I'm continuing to fight for homeopathy. Yes, you can say also fight. It needs a fight sometimes. It needs a fight sometimes because, as Marianne said, people don't know what it is, think it is something very harmless, very
like magic, maybe.
yeah, something like this, they don't understand. And so we have to talk about it. That's why I'm here today. Thank you, Marianne, for organizing this.
Thank you. Rajeshwari.
Good morning, good afternoon, all of you. And I'm really privileged to be amongst all of you. I am a homeopathic consultant and I've been into academics. Since last 23 years, I've been teaching anatomy. I'm the professor and HOD, and I'm quite passionate about homeopathy. I just luckily came into homeopathy while searching for the medical studies like any other student does in India. So I came into homeopathy, and since then homeopathy has been my passion, and I have been treating people with only homeopathy.
That's nice.
That's the thing. And my thinking is that integration of the medicine is the necessity in this COVID era, especially. As Dr. Jaswant Patil said that every science has its limitation. In the similar way, like homeopathy has its own limitations, and conventional medicine also has its limitations. So it will be so beautiful and wonderful when these two sciences come together and then work for the people. It will be amazing, and it will give a very good results for the suffering people. That's it. And one more thing I wanted to tell you that some 4 years back, when my husband was having ARDS and he was admitted into one of the reputed hospitals, and he was suffering like anything, and he was on ventilator for around 15 days. He was on ventilator, and it was very bad days for me. And I saw that there was lacking, that I was passionate about homeopathy, but I was not able to treat him with homeopathic medicines. But some of my friends who were homeopaths came to rescue. Somehow they prescribed the medicines, but the doctors who were there, they did not allow the medicines to be given to him, and unfortunately I lost him, and he really fought a very bad battle, and it was very sad for me. And the main element of humanity is somewhere lacking in the medical field. That is what I experienced when he was in the hospital at that time. When he was discharged, even now I can feel the goosebumps, and I can feel the pain in my heart that he was refused the clothes which were given by the hospital during the stay. And when he was discharged from that time, and he had to wait for 1 hour, we had to wait there until my son went on to the market and bought a new set of clothes, and then he made him wear that, and then on the way, on the same oxygen, we were transferred to another hospital for the ventilator. That was the condition. So I think, can't big hospitals, multi-specialty corporate hospitals, on the humanity basis, at least sanction one pair of clothes for the patient while he is being discharged? This is a very painful thing. When we are paying lakhs and lakhs of money to the hospitals, this is the condition.
I can understand.
Very sad.
Yeah.
Sorry to hear about that.
Yeah, very, very sad and sorry. Anyway, this is a picture because usually, you know, I being into an allopathy and so much of workload and so much of pressure, the other people who are managing, that is administrative side, the suggestions that come from the patients, it's really sad. I'm Dr. Rajeshwari. Rajeshwari, what you narrated, it is a sad story, and one must learn from this. And there, a doctor has to be compassionate because he is directly in connection with the patient. Whatever the discrepancies of the administration and everything, he has to face the wrath. He has to face all the problems, and therefore there should be a communication, because usually I used to face the same problem when I used to communicate to the higher authorities, but it's to fall on the deaf ears because they are not facing directly, seeing what exactly the emotions are disturbed. And that needs to be debated and talked. And once it reaches through social media to this, to there, that he is a human being, and doctor has to be compassionate. Just not doctor, but whole of the administration that is doing this job. They need to think over it, because you can't just sit and watch. And when complaints are coming, you have to be considerate. There is something. Complaints may be wrong 50%, but 50% is a truth in it, and that needs to be taken care of. I'm sorry to hear that, but it's a fact. And I'm here because as an allopath, I face the same thing: wrath of the patient when patient dies, uh, anger, frustration, because someone who loses the loved ones, he gets wild. And for that, doctor needs to be very attentive. You know, moment a relative calls, I used to run and go. Why? Because I know that I cannot save, but I should attend this as his wish.
Yeah.
There is limitations, and after that I learned that I never faced in my life anyone getting angry on me as a doctor, because I used to talk to them, have a rapport, build up the confidence, and show that I am working. Even if it is patient is dead, try to do something. And particularly that particular action has given me one. I'll share my experience as an allopath. When I was in allopathy in my nursing home and ICU, my own private, after shifting to homeopathy, gradually, when the number of admissions went down, because the patients who were getting admitted were chronic diseases. With homeopathy, they used to get better, never need an admission. So my indoor used to go down. So I said, asthma patient was getting admitted 3 times in a year of the weather change. He's not requiring admissions. So gradually the indoor started going down, stopped, only ICU was remaining. And I said, ICU, if the OPD was so high, I cannot give attention to ICU patients. So it stopped. And there, one patient came. When I had closed down my ICU, a doctor came with that patient and said, sir, you have to do something. I said, I will stop my ICU. Why did you bring it here? You get out your all equipments and see that you at least try. Otherwise, there are people of 100 outside a mob, and I have to face them. You'll also have to face it. I said, okay, that's all right. I can convince them, and we will try. We tried. I got all my equipments out, defibrillator, monitor, and ambu bag, ventilator, everything. To start with, I started with ambu bag because he was almost dead. ECG was showing a flat line. And now what to do? So we gave everything, DC shock, intracardiac adrenaline, everything, called relatives, see, we have tried. Let one person was standing next to us to see exactly what we are doing. So they get, the doctor is trying and doctor has done. Because you should understand their feelings also. They are also, imagine yourself in that position. As a doctor, when you are like a relative, you know what is the pain of a relative. And therefore, that patient, they were satisfied. Finally, everything went off. But I was not all right. I was not all right. I said, what is this happened? What, this was a show, and God, this is not good. And that time I said, why not try homeopathy here? So I gave 1 drop of liquid camphor on the tongue, took dopamine, which is given in the drip form. Instead of adrenaline, I took a dopamine syringe, about 2.5 to 3 cc, and put intracardiac, gave a DC shock. And with that, suddenly the heart started jumping, the lines started coming, the ECG started coming, and patient started breathing on its own. So I said, oh my God, patient is revived. So, in this procedure, I think more than 10 minutes were lost. Now, as per our medical science, 4 minutes, brain is dead. Now, how one can believe this? So I said, anyway, patient is alive, whether he's unconscious or what, at least our efforts have brought back the life. And I was very happy. I called the doctor. I said, look here, I've stopped my ICU now. I'm just into homeopathy. So please take over the patient to your hospital. He said, I'm sorry, I don't have ventilator. And you can shift in any other hospital. And no one was ready to take, because they said, you have revived, but this man is now brain dead. He will be just like a vegetable on ventilator for a long time. I said, see, don't predict. You do not know what are the God's act. As medical science, there are limitations. You should do constantly your job to save the lives. You should constantly work. Just don't give up the hopes. That is like losing the battle just out of fear and not doing anything. So finally, I shifted him to one of the hospitals where ventilator was there. But they said that since the patient was having his own breathing, they kept on intermittent ambu bag. And finally, in the morning, that patient was fully awake. It's a miracle. It's a miracle for me in my life. I'm sharing this experience for all the doctors who are listening, that never give up hopes. Try, because it has been said that many times the life is suspended, not dead. And our medical parameters of EEG and ECG, you can overcome that if you sincerely try. Give one more chance and try till the last, and you can save so many lives. And that is what is needed in today's COVID time. So many people are dying. I'm sad. I feel sorry. I feel helpless. I feel hopeless when no one is listening. And then integration is there. And when I got a chance, I could treat, I can share so many cases. It will require hours together to share. But one must work hard to save the lives. And that is a duty of a doctor. Doctor is a born doctor. Is not doctor for a pathy, but he is for the patient. So whichever pathy he uses, whatever, but he should use it diligently. And other doctors are not understanding, because the training of allopathy is so hardcore. It is very difficult to believe. And therefore, other sciences must be researched in the same manner in which allopathy is researched. Then they will start, because they are scientific brains. I cannot blame them. I was one of them. It's very difficult for them to understand what is this. They are also skeptical. If I use this, allow them, and something goes wrong, what will happen? So they too have fears. And homeopath knows, oh, I'm sure this is going to help, but how sure you are? But I'm not sure as an allopath. So if something goes wrong, who will be responsible? So their worries is also right. Our aspirations, our intentions are also good. The understanding between the pathies is a need of today's time. So therefore, while education is medical education, I appeal to the people who form the educational studies that all other sciences should also be taught as a subject of introduction, so that they come to know what is there, and experiences should be shared, so that there would not be a negativity. Suddenly, a person is asked to change his religion, his caste, his way of style of living. It's very difficult to adjust. And therefore, we need a training right from the beginning. So COVID has taught us many things, and I think it will open up the eyes of everyone that we need an integration. But before integration, every doctor must have a knowledge of other sciences also, at least a knowledge if they are not practicing. So they come to know, so they can see I'd shown 50 cases of third and fourth stages getting cured with purely with homeopathy when chemotherapy, everything had failed to the Science and Technology Department for getting my project to be sanctioned as a homeopathy for research and development. And they were amazed and shocked. And no one showed us so many cases that homeopathy can do this much. We were thinking it's just a science of tonsils, warts, skin diseases. And when they saw, they themselves said, and they voice voted to pass that project. And that time I realized that Allopath needs to be convinced that homeopathy is working by the way of case presentation, case reporting, and researches that will be applicable to when he reads that in a scientific way as they have been taught, then I think they can accept. Otherwise, it will be just we are blaming them, they are blaming us, and the things will go on. And in this, people are going to die. That is tragedy, the sad part.
Yes, and this is the tragedy, that we are talking about being right and what is the best system, but we are not having the focus on the client, on the one who suffers.
That is true.
I think, this is the problem. I do agree with you, Dr. Patil, in some ways, but I think it has a lot to do with the personality of the doctor.
Yes.
And any therapy, you can take allopathy, homeopathy also, from the moment that it's about you as a doctor, it's just about you and your success, then you get you don't get through to the patient.
Yeah.
And this is a basic problem of humanity. We are all psoric, and we are all want to have success and want to have claps. Wow, great doctor, great success, best teacher, best I don't know what. This is our basic weakness, and we have to be very conscious about it in homeopathy, because if homeopathy is an art to practice, and if you practice it rightly, in my opinion, it is a very humane, very spiritual therapy. And it has, because it belongs to nature, it comes from the warmth of nature, it has unlimited possibilities. Not everything can be healed, and not everything can be done by homeopathy. But I think that we should show as you said, we should show what we do. I don't think we should try to convince allopathy, because this is tried since the time of Hahnemann. And sorry, but if they want to get convinced, there is enough evidence, there are enough cases documented. This is loss of time. But we should go to the public. We should go to the public, and we should show them, and what we do, what homeopathy can do, also in COVID, because this is not known. This is not known. People think that, oh my God, if I have COVID, I'm half dead on the ventilator. This is far from being the case, and we can help a lot with homeopathy. These are messages we have to stand for as homeopaths, because this is our clinical experience, daily experience in our clinics. No, so
that's true. I agree with you, and. That's the reason, once you have been trained in one faculty, then it's very difficult to change and accept. So it should be put directly into the basic, from the first class of medical science, that it should be introduced that time. Otherwise,
do you remember, Dr. Patil, when you left allopathy, how difficult it was suddenly to be nobody anymore? You remember that? You remember that from being a very renowned allopathic doctor, you were just a homeopathic doctor? Yeah. And this is the point. Okay, this is the point that I remember everywhere when it happened to me. I said, oh gosh, and this and that, and I'm not allowed anything. This is a personal way, and Hahnemann showed us the way. Come on. He showed us the way that we have to be self-critical, and we have to be ready to pay any price if we think that what we do is true. He had also to go all through this. Like you said, you were not happy with allopathy. I was also not happy with allopathy, looking for something else. When you find it, then, we should go for it. But this is a personality problem, and we cannot expect this from everybody. This is our way to go in our lives, and other people have their rights to be in their lines. I have no problem with allopathy, and I just think that there should be respect between allopath and homeopath so that we can work together. This is the only thing. I highly respect good allopaths. I highly respect them. This is a very high science, very difficult science, but they should also have the greatness to respect other therapies, amongst them homeopathy.
I agree with you, because it's a time that the COVID time that has come, and when allopathy has got a limitations, at least this is a time when both sciences, if they come together, you know why? Because Dr. Hahnemann was an allopath. He was a hardcore allopath. And he left practice of allopathy because that time, the science was not that good advanced. Bloodletting was a treatment that time for hypertension. And he said people are dying more by the treatment than by the disease. And that is how the homeopathy was discovered. And the whole language in homeopathy is an allopathic language. So it was very easy for me to pick up, because the base allopathy doctor who has formed particularly the homeopathic science discovered this. It was in a same language, but the principles of treatment were as per the nature's law. So what was said to allopathy treats the disease in the man, and homeopathy treats the man in the disease. Mm-hmm. So the root cause when treated, that time, the patient gets well to its most natural way without getting side effects. But there are diseases which are incurable, where even homeopathy has got limitations, allopathy has got limitations, both have got limitations, and both together, when come together, these limitations can be crossed, and we can win over the sufferings of the patient and can save life. Like, for example, I'll give you one of the patient who was my staff working in a clinic, and he developed COVID. And he was seeing cases, but he was very confident because he was saying, sir is treating and everyone is getting well, so I will also get well. So what he did for first 3 days, he took treatment on his own because he was knowing, sir is prescribing the standard this, so I take it, and he didn't inform me. And in that, the disease increased. So first 3 days of COVID is very important. First 24 hours, if you miss the proper treatment, then you land into complications. You take any pathy, either you take allopathy, homeopathy, Ayurveda, other therapies, but the first 24 hours are very important. And the moment you give the medicines, you must see the results within hours. If you are not getting results within hours, even with homeopathy, you should think that there is something wrong somewhere. And this boy, who is just 40-year-old, a very sincere worker of mine, and he started getting into more and more problem. And the fever is to go to 103. Now, I deter giving paracetamol, because paracetamol first brings down the fever and again then jumps to more high. So secondary action is very bad. Particularly in COVID cases, I've seen if you try to treat fever, you will land into problems. Instead of that, treat the inflammation part of the fever. So these are the two things. One is inflammation, and second is infection. So here I gave him Hepercel for the infection and Epis for his inflammation. Fever slightly came down, but he was not responding. Finally, on 5th and 6th day, his oxygen dropped down to 92, 90, and it was a very bad situation. Now I have to rethink the prescription and do something. And now here I thought that even if I give second prescription, if it is not right, I'll be losing time. So here the need for integration came. And just 16 milligrams of methylprednisolone, Medrol, with Veratrum viridi Bryonia, and Carbovage. These three medicines alternated once, and the fever was down on its own without paracetamol. I was not giving paracetamol all those days. It came down to 97 within 2 hours. And before that, I started with homeopathy, that is Veratrum Viridi, Bryonia, and Carbovage. And that three drugs improved the oxygen from 90 to 95, 96. So oxygen was improved because of homeopathic treatment. Fever, the inflammatory cytokines were taken care of that. And then that time I was asking him, are you afraid? Are you fearful? He said, no, sir. Well, you are there. Why I should be afraid of? And then I said, my dear, I think we are in a checkmate position and we need to get you admitted now for giving oxygen. Then he started crying and burst into tears. I could see that fear. At that time I realized this fear causes suppression of adrenal axis and the internal steroids that are released to take care of the excess cytokines inflammation. So pro-inflammatory and anti-inflammatory cytokines, they are not released, as well as the steroids are not. So this particular small dose, and then next day it was only 4 milligrams. Third day, fourth day, it was only 2 milligrams. And it's such a small dose of steroid and homeopathic combination. This person improved so nicely. There is another case where I was in a village where there is no facilities available. Patient cannot go. And he was in a very bad condition. When he was brought, it was, when I saw the oxygen had already fallen down to 70. I said, my dear, I can't treat you at home. You have to go to the hospital. There is no way out. There is a lockdown. There are no services. I say, you call the helpline number. So I called the helpline number. I'm not getting any response. And it was a very bad situation. I said, okay, you keep on trying. Till that time, I will try to treat you. Till the time you get an access to an hospital. And can you get one oxygen cylinder from nearby doctor? So they got oxygen cylinder from nearby place, which was about, say, 40-50 kilometers away. From there, the oxygen cylinder was brought and I started treating him. Started with Bryonia, Carbovage, and Veratrum Viridi and Ferrum Phos. Now I had no choice to think, take the repertorization, work as per the principles, because he was into a semi-comatose state. And by the time oxygen came, then immediately the oxygen improved from 70 to 80, 85, but still it was dropping down. When he used to go for a bathroom, it used to drop to 40, 50 also. So I was afraid he may die at home. But luckily, oxygen cylinder came, and with just 4 liters of oxygen, his oxygen improved to 90 to 92. And it was remaining. Only when he used to go for a toilet, that time it used to fall down. And it remained, and in 6-7 days time, it came back to 97, 98. So these are the things when if this same person, this was purely on homeopathy, not a single allopathic drug was used here. So I have given you 2 cases with an integrative approach and where we should. So doctor has to be very considerate and passionate. He should not be a fanatic of any science, but he should be treating the patient, what is good for the patient, what is happening, the situation, and he has to take immediate decisions. Otherwise, you will lose the life.
What you said, Dr. Patil, is actually right. It's important, I think, for the public to know, that homeopathy can be used always as alternative medicine, but also as together with allopathic drugs. So there is no reason why we cannot, homeopathy is not used in allopathic hospital, with COVID patient. There is no reason, just because we have to hide it. The wife of the patient has to smuggle it in. And these are no conditions, these are no conditions. And some allopathic doctors are open, but very few. And it is up to the patients really to fight for their rights, because it's their own right. There is no interaction between homeopathic drugs in potency and allopathic drugs. That's it. There is no interaction in the sense of pharmacological interaction. And so there is no risk. And people should know that we can help also, even if they are getting whatever allopathy gives. What I don't understand, allopathy doesn't have much. Okay, oxygen and all all this kind of stuff, this is okay. But otherwise, against viral disease of such kind, they have almost nothing. They are trying to give some stuff, but which with more or less good results. But why don't accept to, when homeopathy has a history of more of 200 years of successes in epidemics, what is the problem? What is, this is very, we have in our clinic, of course, we don't have access to, or we have a few patients who landed in the hospital, and called us from the hospital. We didn't have any of the patients that we were helping through this phase who landed in the hospital. So it was, we could, but what you said is I can really also say the same. It has to be, we have to get them from the beginning. If they come after 1 week, because we have this problem with COVID, often here, I say what we're seeing in Switzerland, often they have like a very small flu. They hardly think about that it can be COVID, really very, very 2, 3, 4 days, a little bit throat pain, a little bit cough, nothing much, no? And then they don't go, they continue their life. And then after 1 week, paf, then it comes and it comes worse. And then they come to us. And when we can have them from the beginning, it is much easier to go through the second phase, if second phase is.
Correct.
We treat in our center, we treat only with single medicines. It goes also very well. We individualize the patient and we give only one medicine. What we've seen in the first wave and in the second wave is that we have how do you say this in English? Genus epidemicus. Mm-hmm. We have one in our region, at least. Seems to be also in the second wave. The most common remedy is bryonia. It remained from the first wave to the second wave, often followed by phosphorus. So we have, some tendencies, but we have homeopathy believes in individuality. Correct. So we have patients with Rastox, we have patients with Pulsatilla, we have patients with any other drugs which is indicated. This is very important also for the people to understand. There is no way that that a patient can treat himself, with homeopathy without consulting a homeopath. Because there is a lot of things online, you should do this, you take this medicine. This is not the way, because every patient is different.
Yes, I agree with you. The individualized remedy is the best remedy. And it's only thing that there are so many homeopaths who are budding homeopaths, new homeopaths. The homeopathy being more of an art. So that till the time they get that art, it is very difficult for them to treat. And when they fail, the homeopathy name comes that homeopathy has not worked and homeopathy has failed. So homeopathy never fails. Homeopathy never fails. What fails is the understanding of a doctor, analyzing power of a doctor and what patient tells about himself to a doctor. So it's an art of a doctor to take out an history. It is art of the doctor to analyze the things. It is art of a doctor to know what exactly is to be treated in the patient and what is treatable in the remedy. And the combination is so difficult. Therefore, the success, like you give paracetamol to 20 patients and all of them get well. In respect to fever, not as a whole, but you see the effect that we cannot see in homeopathy. When the fever is not coming down, the relatives are in panic. Sir, fever nahi aa raha hai. Fever is not coming down. Fever is not coming down. What should be the next? So they are afraid. They don't know the fever is a friend of body. It is a physiological action of the body to stimulate the bone marrow to form more of the white cells. And if you bring down the fever, what happens? The white cells the stimulus to the bone marrow gets suppressed and patient falls prey to the viruses and bacterial infections that is invading. Second, as the fever rises, the thermostat is set high. That time, the multiplication rate of virus and bacteria goes down. So the aim is not to bring down the fever. The aim is to treat the disease which is causing and giving fever. So when we treat that at the root by thinking in a proper homeopathic way, that particular single individualized remedy, I have seen it should be giving relief within 5 to 10 minutes. Mm-hmm. And that is what I have experienced when my son developed and fever. He started typically with the sore throat and everything. And he came to me that I'm not feeling well. I'm sick. I'm having irritation in the throat. I feel weak. There is malaise. And I feel there is no energy in my body. I say, oh my God, you're developing COVID symptoms. First, go and get isolated. Then I went to him with a mask. And with a mask, I just took his whole history. And finally, he said, what is a very typical symptom? What is there? He says, I'm feeling coldness in my toes. Now, after taking the whole general symptoms, common symptoms, everything, the coldness in the toes was a characteristic symptoms. And I touched it they were cold. And lycopodium was coming prominently. 1 dose of lycopodium. Just 1 dose of lycopodium. And he says, Dad, I'm feeling energetic now. And I'm fine. Mm-hmm. And the fever, which was 99, it came down to 97. Now, what happened there? Then I said, come on, I won the case. I won the battle. And immediately within half an hour or 40 minutes, he said, I'm feeling chilly. Now, here in particularly COVID cases, I am seeing there is constant change of the picture, even of the individualization. So, but I said, no, lycopodium worked, so I'll give 1 more lycopodium only. And it failed. And he started getting fever. Then he was a little bit restless and he asked for water. I said, no, it's an arsenic. I gave him arsenic 200 and it failed. Fever started rising to 100, 100.3, 100.4. And then I realized that as soon as the fever started rising, he was feeling sleepy. So again, sleepiness, fever during, with all his previous symptoms that matched Eupatropine perforatum and 1 dose on a tongue. And in 5 minutes, he says, he just got up on the bed. Dad, I'm feeling energetic now. Again. I said, my God, again, after some time, you may say you're not feeling energetic. But I was continuously watching. Now, this is a complementary effect. It's the main remedy with complementary effect. You cannot just give up and you have to see the results fast. Otherwise, you are wasting time in COVID and patient is getting serious and then homeopathy is blamed. So then I saw him and then he said he's getting better. And then fever didn't come. And he had his full meal as if nothing happened. And that was the time. Now I have experienced that in my own house. And I was a treating doctor. I was a treating doctor as well as I was a father, as my wife got it. She was also a patient. She had an extensive right upper lobe involvement with thrombosis and CRP went to 68. It was a nightmare and she was not responding. So there again, finally, she responded to phosphorus 200. Bryonia is coming very prominently. Carbovage is coming when bryonia is given and oxygen is not coming up. Carbovage works wonders. But in later stages, Carbovage stopped working when Viridi works to bring up. So whatever individualized remedy you are giving, and if you're not seeing the results, you have to give the complementary or follows well remedy without wasting a time. That was my experience. And I was thinking now it's my turn to get a COVID. And if I get, who will treat me? Because you need proper senses. God is great. I didn't get it. And I said, I'm a homeopath, so might be I may not.
You seem pretty fit and energetic, doctor. I think you're going to stay okay, you know. But I think, you know, we see that why is it such a changing picture? I do agree with you. This is a characteristic that we are seeing, you know. And this is, and it needs, that's the reason why it is quite seldom, it happens, but it is quite seldom that just one medicine will do the job. This is more often that we need to have a few medicines. This is also in the experience that we are having here. Not the light cases, they might be good with just one bryonia or whatever, you get arsenicum or whatever, but the more complicated case, definitely. You know, I do agree. But I think this is also the miasmatic character of the disease, which seems to be very tubercular. Because tubercular is also the complications, tubercular is also the changeability, and tubercular is also the massive, this kind of paralytic weakness that they are developing during it or after it. I can tell you the case of an 85 years old, and situation in Switzerland is we are not allowed, when the patient has COVID, he is quarantined. So all our treatments are through telemedicine or telephones, which is suboptimal as a homeopathic doctor, but it works, but it is, let's say, suboptimal. Anyway, and this lady, first she got bryonia, it went very well. Then there was a phase of, after 1 week, suddenly she calls me and said, oh, I have some problem, you know, it's problem to breathe. And she could hardly talk, she was so weak, so weak. And we have, in such case, we have good success with acidum carbolicum, and give her this in half an hour time. She said, now I can breathe through. Now I can breathe through. She never made any fever, the whole thing. You know, 85 years old, it can, I mean, they make fever less as it is, and she didn't make any fever. And then it went okay, she was okay, appetite was not so good, but it was not going further. I repeated acidum carbolicum, thinking it will help her to get some more energy, 0. Then I took up the case again, and then I gave a medicine which we had a lot of success in this, when the main symptom is not anymore the respiratory problems, it is more this weakness. You know, no appetite, weakness, just no desire for anything, and a little bit, the feeling that I cannot breathe deep enough. These are symptoms, and we have a lot of success with natrium arsenicosum, not ours. It's a medicine that we organized homeopathic proving many years back, and we found many very interesting symptoms. Anyway, I gave her this. It took some time because I had to send it to her. She didn't have it, so we lost a few days. And by that time, I was thinking, my God, she's going, you know, weakness was going down. And then she takes the medicine, and I called her in the evening, completely another voice, completely, you know. I'd call her the next morning. She said, yeah, I think I want to go to the hairdresser. I said, no, please, please don't go to the hairdresser. I called her in the evening. She said, yeah, I'm a little bit tired now. I went to the hairdresser. I said, okay. And she walked for 1 hour. She walked 1 hour, 1 day after natrium arsenicosum, you know. So these are the you get goosebumps as a homeopath, you know. You get so thankful to Hahnemann to give us this therapy. But it needs, as you said, it needs a very narrow monitoring of these patients.
I agree.
Because we have to see, you know, when we had we are following a patient who has problem. He is an asthmatic patient, so they tend to have, as it is, more problem, of course. And but every time he reacts really beautifully. If it is Carbovec, now Spongia, now not ours, you know, but it needed a few medicines. So
we have a question here. Somebody asked why Veratrum viride was given.
Yes, it's a very good question. Basically, whenever there is a congestion, vasculitis, and the symptom pathology is matching to the veratrum viridi, but as per the homeopathic principle, the characteristic symptom should also match. And patient is usually in a state of fear, not ready to give proper history. In that, I found the pulse rate was very high. So there is only one rubric, pulse very high in pneumonia, and that is veratrum viridi. And that made me select veratrum viridi, and it worked magic in that particular thing, and I could see the result. So then I started studying more rubrics that are related to veratrum viridi, and I found that many things that match. The most important was when patient is walking down to a toilet, and when he comes down, he feels giddy. There is sudden drop of the postural blood pressure. So the postural hypotension. So there, the rubric is converted, this particular clinical sign is converted into the patient language, and patient language is converted into homeopathic rubric language. So that particularly fitted into the veratrum viridi, and therefore it was my drug of choice. And it changed the whole scenario when the oxygen had fallen down to 85. So it was a time when that particular patient was waiting for getting admitted. This is one of the patients there where I had selected this. And I said, you just take this and let me see after 1 hour. I said only 1 hour. Let me check. And 1 hour, the oxygen improved to 90. And I was confident. I said, wait a minute. Don't go to hospital. Let me try at home. And we will wait for another 4-5 hours. If it doesn't improve, again goes down, then you definitely go and go to the hospital, because the fear phobia of going to the hospital puts down the patient. I have seen people are dying more out of fear than out of the disease. There is a notion that once you go to hospital, they do just farewell to all relatives, as if he's not going to see them again. So sad part, so tragic part. And it is really, you feel with tears in the eyes that, oh God, no one should get this time. And that's the reason, at the same patient, I said, wait for another hour. And with the same excitation and enlightened feeling, that oxygen came in 4 hours to 95. And that was a time I said, now nothing doing. Now 95, you can survive. Even many times you check your own, it is 95, 96 when you're not breathing or you're indoors or with a mask. So I said, okay, fine. Then you can do very well at home. So this particular patient was, if he would have gone there, and he was just frightened. Doctor, if I go, I will not come back. I will not come back. So that fear factor needs to be treated. Whenever I get such type of patients with fear, my drug of choice is always Aconite 200, fear of death with fast pulse and mouth getting dry. Aconite works better. And I start with Aconite, then come to arrive at another remedy. Because here in particularly COVID times, you just stick on to one remedy is not happening. And many times I've seen, you give one remedy, fever comes down, again you repeat that same remedy, fever goes up. I do not know whether you people have experienced that. And it is really, then what I do, then not to give anything, just wait. Fever drop 0.2, 0.2, 0.2, 0.2, 0.2, 0.2, 0.2, 0.2. Over a period of 8 hours comes down to normal. And more we give medications, more fever rises. So during fever treatment is really a tricky thing in homeopathy, which I have seen. Unless you have individualized the remedy and given it, and you got the individualized remedy. Because the individualization is something which I would like to share, that if we all 4 are there, or take another 10 topmost homeopaths in the world, let one patient go to all, and everyone arrives at different remedy. So, so how this individualization becomes an art. So therefore, one has to be very sure what individualized remedy he says. It has to be perfect, and it should start acting immediately, because Dr. Hahnemann has said in his first definition, rapid, gentle, and permanent restoration to the health. So the rapid part is always missing. That means your remedy selection is not right.
So we again have two questions. One is, what potencies do you use?
Basically, depending on the what is the gravity of the symptoms. If the patient is having less symptoms, the intensity is less, I prefer 30 potency. If the symptoms are of more than 200 potency, again you have to see the vital force. If the patient's vital force is low, then not to go for a higher potencies. I go even little low, and then gradually increase the potencies once I get a result.
We treat in Switzerland, we also see C30 or 200 or LM1, Q1. This is, it depends a little bit of the patient. And what we do, we always give, we dissolve the dose in water and we give sip-wise. We see a difference in action. The action is much softer. We don't have what you said, doctor, about when you repeat the dose that the fever goes up again. We did not see this in our patients, but we give always, one sip and then one, depends the gravity of the case. The case is quite acute, maybe every 10, 15 minutes a sip till it improves, but mostly we start with C30 or 200, depending of, as you said, of the gravity of the case.
Yeah, I would like to add here that in majority of the cases, Carbovage at 30 potency, 30 C potency works better, and Bryonia at 200, because there you require a better potency than a 30 potency, because the intensity of the disease and the pathology that needs to be covered. So Bryonia 200 is my first choice when the patient is going into. And secondly, what I do, moment he gets cough, and the cough of COVID is typical, only 2. That is a start. Then later it goes on increasing. And when it increases, he holds. Then again it comes to a Bryonia. And there, every time he gets a cough, repeat the remedy. And that gives a faster relief. And I say, don't repeat the remedy if you don't get a cough. Wait and watch. Because many times repeating too frequently can also cause a problem. So you need to be very meticulous in observing the patient, giving them time. Just give a remedy and see me tomorrow. This should not be a case into COVID cases. I always say that keep 3 people in a group, form a WhatsApp group of your health, your name and health group, and keep me reporting every half an hour or every 1 hour, pulse, oxygen, and fever, and symptoms. What is the change and what are the new symptoms that add on? So just changing picture of COVID, you should catch at the right time, so that if you want to add a remedy or change the remedy.
Yeah, but doctor, yes, maybe in some cases, in some heavy cases, but there are also many other cases where we've seen that just waiting 1 more hour and the symptoms were gone again.
Yeah, there we don't require.
Just waiting 2 more hours and then suddenly, we were thinking of changing the medicine. We say, let's wait 2 hours, we call again, and it's all good. So changing the medicine at every change of picture, maybe also a bit too much, as long there is one principle in homeopathy, how does you feel? If the patient say, I'm more energetic, I feel better, I don't care about his fever and his cough, but he has to feel stronger, to feel better, to have more hope, the voice has to be stronger. Then this is the way we treat. We wait a little bit, but we might have also much less dangerous or advanced cases as you are having. This is, I think, also a difference,
Basically, I'm treating more advanced cases. Those who are not well, then they come to me.
Absolutely.
I have to be on my toes. But what you say, I agree that in the initial stages, likewise, COVID cases, 70% of them get well. My daughter is she's a MBBS. She has done a graduation, and she was attending the mothers. She said, "Dad, you are above 60 and you should stay away, and I'll give you a feedback and you should treat." I said, "But I have to auscultate and see whether there are crepitations, whether the bronchi is there, whether she's going to pneumonia. So I need to come frequently." She said, "I will call you whenever you are required, but you come with your mask and wash your hands." So with mask and washing hands, you can save yourself. That is what I have experienced in my own case. So she was sleeping with mom in the same room, on the same bed. I said, "You're taking a risk." She said, "I'm a young and I'm not afraid and I'll not get anything. Don't worry that." And she got a fever. She got a fever. She had 9900, not more. And she didn't tell me. She said, "You will immediately give me medicine." So I did tell you. And she herself took arsenical without asking me, only one single dose. And after 6-7 hours, she told me that I was feeling so and so, and I'm fine now. I don't need any medicines, and I'm okay. And she was okay. She was fine. And now in this particular, these are my personal observation, because I happen to see the COVID cases right in my house. And there I realized that when we did IgM, COVID, and IgG, at the 14th day, they were negative for my wife. But the CT scan was very typical of COVID pneumonia. And then she never developed IgG antibodies. She never developed IgG. And I was surprised how she has not developed IgG antibodies. But my daughter, she developed IgG antibodies. And it was 38. Here the cutoff value was less than normal range in my wife's case. And there I realized she developed such a good antibodies. She can be a plasma donor and she has not developed anything. So she is at risk. Even I checked my own antibodies, my son's antibodies, my another son antibodies for IgG, and they came negative. So only this girl, my daughter, she got positive. And then I realized that she let her body fight the COVID disease. And in the initial stages in March, April, when we had done some cases, by requesting the doctor that let us give the medicines and see what happens. And it's not going to harm, because I'm an allopath, I'm a homeopath. I know the homeopathy and allopathy is going to go very well. You believe me. And he was known to me. So he agreed to that. He said, "I'll give you only 5-6 cases, but nothing should go wrong. That is my responsibility." And there, the 4th day, the COVID test came negative. So it was a surprise for them. It was a surprise for them that yes, they have come negative. And therefore, I feel those who have been treated with homeopathic drugs, we must check IgG antibodies and see whether the same thing is happening with all patients. It is my personal individual experience. So we must always look for it and find out what is happening and whether they are again prone to the second infection. So now second wave is coming.
You must be aware of the work, of course, of Dr. Kumar, no? With what he published with all the study he made with Bryonia mostly. And in his study, he said that most of the patients were in the group that he used to make the study. Most of the patients were negative, COVID negative after 1 week. So this is definitely something which is seen in other cases.
Yes.
There are 2 other questions now. One is, why was carbolic acid given? And when do we stop the medicine and don't go for repetition anymore?
Acidum carbolicum has, I got this tip, I must say, from a colleague, from a homeopathic doctor of the region. And she had very good success in the first wave with it. So when she told me this, I said, okay, let's go and study acidum carbolicum again and see this. And acidum carbolicum is a strong antiseptic. It is a septicemia medicine. So you have this absolute, what we've seen, it is fear of COVID is very, very strong. It has the fear of, the fear of arsenicum. It has the worsening on the smallest movement of bryonia, with pain, on smallest movements of bryonia. And it has the absolute weakness, the terrible paralytic weakness that you may see in many other medicines without they are not so restless. They're just like this. And it has this feeling, I cannot breathe deep enough. That just doesn't go, it's blocked. I have to breathe just very shallow. Not so much because of the pain of, like you see in bryonia, like this, but it doesn't go down. And we have had some cases now, because hearing this from my colleague, of course, you are more than, you start seeing this in your patients. And we had some cases where really, like I told you, in the 85 years old, you have an immediate response. I also use this acidum carbolicum in case of tremendous fear of COVID. I had patients, and my colleagues had also such cases where people did not even dare to go out, to make their shopping or to whatever. So scared of this. I have a man, he started to build up things around his house to protect him from COVID. He was getting mental. And we gave him this acidum carbolicum C30, a few doses. And then I asked again, and I said, no, now he went shopping with a mask, but he went shopping. So this is a medicine which I must say, this is a limited experience that we are having with it, because otherwise it is a medicine known more for burns and all this field that we know from acidum carbolicum. And what was the second question, Mariam?
When do we stop the medication and when do we repeat?
This is a good question. I would say the way we do it, we give in the beginning a few doses depending, hourly 2 times or every 10 minutes 2 times. The more acute the case, the more you repeat, and we give 2-3 times like this, and then we give it, if the case goes better, then we give maybe every 4 hours, every 8 hours, once a day. But what I've seen, if we stop, normally we hear in homeopathy, we do it like this, when there is a clear improvement, you don't repeat the dose. Good. The problem that I'm seeing, if we do this in COVID patient, it goes down again.
Correct.
The life force is too much under pressure. So we have patients where we continued as long as the picture is the same, you don't change the medicine. Let's say you are under arsenicum, bryonia, phosphorus, whatever. We give maybe once a day a C30 for maybe a few days, till it is really good. And what we've seen in the cases of, in the cases where we give natrium arsenicosum is the same. The patient needs for a few weeks, even once, twice a week, it's enough. But they need a small help for sometimes till they are really completely good. This is our experience.
Yes, I agree with you, because it's same thing we are experiencing here. Initially, when I started with not minimum repetition, less repetition, or no repetition, as per the homeopathic principles, and patient used to go down that time. And the irony of this particular thing is, it's a disease of happy disease. Hypoxia is a happy hypoxia. So people are reporting false, I'm feeling well. People are reporting false. I'm feeling well. I'm better. So you have to be on your toes, because in homeopathic principle, when we say the patient is saying I'm well, so no repetition, but that is what puts down. That I learned from the mistakes, and then I corrected. No, as you rightly said, that it is a strongly affecting vital force disease, because the energy levels goes down. So the frequent repetitions at particular stipulated periods, say, depending on the severity, if it is more 1 hourly, if it is moderate 2 hourly, 4 hourly, and if it is very less, once in 12 hours or twice in a day, and then when the disease starts reducing, then once a week,
Yes.
till the time you see the change in the symptoms. If the symptoms they stay at the same level and still not getting better, then it's time that we must repeat, because we must see no symptoms. Because we cannot rely, the patient is feeling happy. That
Yeah,
happiness
yeah. It's not about happiness. I do agree with you, and even if but he should feel better. He should also feel better. The voice should get stronger. But you're right. It doesn't mean that we have to stop the medicine, but we have to, instead of giving, let's say, hourly, maybe we just give a little bit at a longer gap. What we have, I don't know if you had this problem, but we had a few cases like this, where after the medicine they were feeling so good. They thought now it's gone. And they went out. I have a patient, he went for a 2 hours walk. They are not allowed to do this. They should be quarantined, but I mean, and the next day he calls me and he said, oh, I feel much worse today. I said, what did you do? And he said, I went for a 2 hours walk. I was so good yesterday. So this is a problem in homeopathy, because they feel the subjective improvement comes before the pathological improvement comes, no?
Yes.
We know this in all the cases. First, the patient feels better, and then the tests, or let's say the laboratory tests, will get better, because the organs need a little bit longer. We see this in all the bladder infection. We see this in all the cases. So the patient should also, we've seen this many times, they should be careful, and we have to tell the patient, no, you have to stay at home. No, you're not allowed to go out on your balcony. I mean, it's freezing temperatures here. We have minus temperatures. This is not really good.
One patient came, he was shopping, and he came to a clinic, and he said, I'm shopping for last few hours. And he climbed up first stairs and then came, and he was apparently, I can see he is breathless. I said, you are breathless. He said, no, sir, I'm not breathless. I can see you are breathless. He says, no, the respiratory rate was 30. So I said, you are breathless? And saying, no. That time I realized, when I read all about the articles on COVID, that ACE2 inhibitor blockade happens. The receptors, they block, and therefore patient cannot sense the symptoms. And therefore it is called as an hypoxia. There is hypoxia. When I checked it was 60. Can you imagine? And he says, I'm well, I'm fine. And this is what state has been called as happy hypoxia. By terminologies given by experts who have done studies on this, how they give happy, I do not know. Patient is happy, doctor is not happy.
Somewhere this resembles to arnica also, where arnica patients also say, I'm okay.
Yeah, agree.
Arnica patients say that. Even though they don't want to approach anybody, if somebody approaches, they will say, don't approach me. Feeling unwell, but still saying, I'm okay. Everything is okay, and be happy. I had treated some patients with Nux vomica, with typical that urging to go to stools. And I also used bryonia and arsenic, heparssulf, belladonna, aconite. These have treated the patient. The fever has gone down with a single dose. Nux vomica 1 ml I had given in the night, and morning the fever was 103 and it reduced to around 97, 96, it went up to 96. So absolutely normal. And after 1 month, one person with Naxvomica 1M, which I had given, after 1 month, he resumed a job after 15 days. And after 1 month, I saw that again he got the fever. And before he was tested for the antibodies and all, everything was normal. But the next time, after joining to office, after 1 month, again he got positive. So that's the situation. And about the variability of the symptoms, there is a total variability. Now, this is what gives the idea of individuality, where our homeopathy works. Yes. Now, it is compulsory for everybody to find the individual symptoms. It may be conventional medicine or it may be homeopathy. Everybody has to be attended individually, and individual case taking has to be taken. Individual symptoms have to be taken, and the medicine has to be determined. That is the case.
Rajeshwari, one question. As the life force is affected so much by this infection, do you use meditation lessons for your clients to rise the energy?
Meditation, yes. I do give meditation sessions also, because basically, as Dr. Jaswant Patil said, that fear is the main reason here, which reduces all the IgG levels. That is one of the reasons, where the immunity goes down and the patient starts feeling unwell, and then he gives the invitation to all the types of infections. So at that time, meditation gives much relief to the patient, giving away the fear, and to maintain the calm. That is one of the important things that meditation does. It boosts one's confidence and removes the fear. For that, I do give the meditation sessions. I just study the case, and according to the symptoms of the patient, what type of mental symptoms the person is getting, depending on that, I prepare a template for them and give the affirmations, positive affirmations to the mind and body, so that it heals from inside. So this I does. Along with the medications, I also plan this meditation sessions.
Very interesting.
I will add to this what Dr. Rajeshwari said. She's doing a wonderful job of meditation. But along with that, pranayam, if you know about pranayam, it's the breathing techniques. There are different types of breathing techniques that has been given in yoga. And we call it as a pranayam, that is breathing techniques in short in English. And these particular breathing techniques, if you do one nostril breathing and then leave it by another, take it and leave by another, many times fear goes down.
Yes.
And fear goes down with your Bastrika pranayam and all, the lungs get a strength. So when you get an infection, your lungs are ready to fight. And the clogged circulation and everything, lungs are very fine. So these are the additional things that we are doing in India, particularly when patients are quarantined. They do not have much of the symptoms, but they are positive. And morning session is taken. There is one doctor who is doing that in one of the hospitals. It was a talk of the town that time. And nobody was going into a bad phase of the lung deterioration. All these patients who were admitted in the quarantine centers, 10% used to go into the bad phase. Even those 10% were not going. That was seen when this was practiced during quarantine period. It was wonderful.
It is not the virus which is making us sick, no?
Right.
It is the weakened life force, and which is making us sick. That's why you didn't get it and some other of your family got it, no? Because obviously this is the same principle. That's why not everybody gets COVID, but the one which are receptive for it, was the life force, for one reason or the other, has some weaknesses. And that's why meditation and all this is a very good help. And positive affirmation is a very good help. And that's also why when you give the medicine, that's the first thing when they feel, now what is this? What is this? I feel hope. I feel it's gonna come okay. Dad, I'm energetic, like your son told you. This is all this effect. No, life force get strengthened, and then body can fight out whichever disease it is. COVID or Tovido, whatever, doesn't matter to us. The name of the virus doesn't matter to us. We have to individualize the cases and can do this. I agree with you, Dr. Rajeshwari. We have to do this, no?
Yeah, Martine,
Yes.
I agree with you because I've seen that unless your emotions are disturbed, your immunity never goes down. So, day my emotions will be disturbed, my immunity will go down, and I'll catch the disease. So, the most important part, what people should observe, they should love their job. They should get engrossed. Even in the lockdown, there are so many things that you keep yourself happy. And happiness is the best medicine. It's the best preventive. Now, people have taken so many preventives, but only 70-80% people could be prevented because they got the happiness. The emotional state was happy. So, happiness is very important to stay away from COVID. That is what I've learned, and that is what has happened in my case. And many times, those particular 2-3 nights when her oxygen was dropping to 92, I had fear with trembling of my limbs and dryness of the mouth. I immediately came out, took one dose of 1 m Iconite, and I was fine. And I survived on Iconite, and then I started getting energy. And therefore, how I preserved myself by taking care of my emotions, taking care of my fear. And that is, I was thinking, how I'm a 60 plus man, the eldest in the house, and all these younger ones are getting affected. And I'm not getting affected because I was continuously, moment a emotion is disturbed, immediately if you take homeopathy, you get stabilized, immunity is stronger, and you don't get an attack of the disease. That is what I learned. I'm sharing my own experiences because it will help so many who are listening today, and they can fight. If they remain happy, they will not get COVID. I'm sure.
If they cannot manage by themselves and they get this fear and fear and fear, in this stage, the appropriate homeopathic medicine will work as a preventive, will calm them down and work as a preventive. This is our experience. Yeah.
Yes.
A lot more questions coming in. I just want to mention laughter yoga as one possibility.
Yes, very good. Very good suggestion.
Yes. Just want to mention that because there are so many possibilities and laughter clubs where you can participate online, and laughing helps a lot. And now I want to go to the questions. Did any of you see hyoscyamus in depression due to COVID?
I have seen.
Okay.
I have seen, particularly, this person was having a great fear. And doctor, will this medicine cause any problem? Will it aggravate my problem? I have heard that many times homeopathy causes problem, increases the problem. And I have taken allopathy a few days back, and it increased my problem. So he was all afraid, suspicion. And he was into excited and depressed state alternately. And there I gave hyoscyamus 200, one single dose, and he calmed down. And then he started responding to the bryonia and carbovate because his oxygen had fallen down.
Great.
Even stramonium I have used in extreme fears, and stramonium has also worked. So to take away that particular fears, stramonium, belladonna, and hyoscyamus, these are the three important remedies that I have used. Luckily, I could get all sorts of patients. So I got a wide variety of medicines that I've used. Now, once the question is raised, I remember, yeah, I've used all this, particularly cytokine storm. And when the symptoms are very violent, just a dose of belladonna 30, because we see suddenness and violence. Belladonna is the drug of choice, and it has worked wonders.
Next question. Did any of you use the COVID-19 no salt?
I have used. I've used in my own family, Dr. Rajesh Shah, who has developed this COVID-19 nozo, particularly India, and that could be one of the reason, that we didn't get that virulent problem, even that though it happened in two of my kids and my wife. But one thing that I have observed is that when you are taking homeopathy, if the remedies they get antidoted, like so many patient people, they say we have taken arsenic, why did we get COVID? Arsenic, giving arsenic is not a guarantee that you will be protected. There are so many other factors that cause your emotional disturbance. Secondly, antidote of homeopathic remedies. Now, many of the homeopaths may not agree with me, but I have seen, it's my personal experience, those who are eating chocolates, strong food that are
Coffee.
strong to taste, strong to smell, coffee and cocoa products, I am seeing them, they are not getting those results of protection of what homeopathy you have given. And that is what I used to tell my son, that I told you not to eat chocolate, you'll get COVID. And he got it. Because now you cannot stop everyone, kids particularly, that can't eat chocolate. And I was very strict. I'm very particular because I know if I fall sick, who would take care of me? So I have to be very alert.
Regarding this, doctor, I think that for the doctors especially, because we homeopaths, when we are sick, there is nobody to take care of us. So let us make one forum where doctors can help each other. Such kind of forum should be made.
Good idea.
Especially during this COVID-19 situation, everybody is in fear. Even we doctors, we are also unsure about what can happen anytime. So
Because that time your brain doesn't work.
yes, because even Dr. Hanneman said when we are about to treat somebody, we should be in a sane condition.
Correct.
So when we are sick, we can't prescribe for ourselves. So
Correct.
we need to make a forum where we can help each other in such conditions. At least the treatment part.
We at least have a speakers forum for our speakers, where we
Yes,
have a channel where all the speakers can connect.
Oh,
So whoever wants
yes.
to participate can participate.
sure, sure.
And next question, when is tuberculinum used in COVID-19?
I've used it twice, tuberculinum, when particularly fever was not responding to any medicines that was well selected. And in those conditions, and particularly I was seeing the picture is of Merksol, but not fitting in Merksol altogether. And that particular patient responded to tuberculinum 200, one dose, particularly if it's a fever part. But when it goes into pneumonia, then tuberculum A works better than tuberculum bovine. That is my experience. I do not know what are the others' experience, but that is what I have seen.
Very interesting. Because I talked with Dr. Priya, and she told me about the resonance of the bird remedies to COVID and the tuberculinum miasm. And that's, again, tuberculinum aviare, what we are talking about. Very, very interesting to me. So next question, what about nitric acid for fear?
Nitric acid for fear is particularly seen in those who are extremely anxious about their own health.
Mm.
They talk about their health, they bother everyone about their health, they are extremely fearful of corona. And I have not given nitric acid to anyone for that particular fear, but one of the patient who was having extreme fear, not particularly COVID case, but extreme fear with the wife said that whenever he goes to toilet, the toilet stinks very badly. And that time with his particular extreme anxiety for health, fear of disease, getting disease, I prescribed him nitric acid 200 and he was fine. But I haven't tried in COVID cases. I didn't get to describe that in COVID case.
Next question. Where is the COVID-19 nosode available?
Not in Switzerland, so I don't know.
I'll tell you that the sad part, what homeopathy doesn't get an access, is Dr. Rajesh Shah is doing his best, and we have done the even the primary things that are required, and that too in a Hafkin exactly the way the allopathic vaccine has been prepared, and the results are I cannot give the results because it's still in the trial phase, and he's my good friend, and therefore with our own limited doctor and circle, we have used that, and I've seen the good results in protection, not 100%, but much better. Even the COVID happens, the intensity is less, but government is not giving the headway because we need to pass very stringent criteria for that.
Yeah.
But
so right now it's not. Right now it's not available. Did I understand it right?
Yeah, it's not available. It's available only for our local circles because we are into the trials.
Yes.
We are the volunteers. So
Is it the same with the circle around Kate
it will
Birch?
make a lot of difference when it will come in the market.
Yeah. Kate Birch is doing research in the US, but it's only available for her circle. And Isaac Golden is doing research in Australia, but the same thing, only around him is available.
Yeah.
But nonetheless, everybody can make it on his own, his or her own. You
Yes.
know how to do it, people. You learned it. Then, next questions are all about we need a forum and we need doctors to connect to protect doctors.
Are doctors so scared?
It's interesting for the moment. And people, thank you for the talk and find it very, very interesting what we are talking here. Next thing, methylene blue per oral is used in one of the cities in Gujarat, India.
Can you repeat?
Methylene blue.
Okay.
Is used in Gujarat in India quite successfully.
It's
Are
sepia.
there any comments on that?
It's sepia. I think sepia. It's not methylene blue.
No, it's a methylene blue. I have heard of it.
Methylene blue?
Yeah, methylene blue. Methylene blue is being used in Gujarat, but I'm not aware because it's
potentized, you mean, or what?
Yeah, potentized. But I'm not aware. I do not have the complete idea about it. But I have heard, and I wanted to go into the details, but I couldn't get time, and I didn't go into it. But I have heard it is being used in Gujarat in some sections, and they are getting good results. Yeah. But it's totally not very clear to me.
Even I heard sepia was also used. Some spraying was done, or sepia in potency, I think. Spraying was done all around.
What?
Yeah.
Spraying of the medicine all around. Okay.
Interesting.
Interesting. Yeah, it's interesting. I've never heard of it. I mean, this is why not? We can olfactory taking in of the medicine is known already in organon.
Yes, because that kind of indifference was there, and people in the early stage, especially when somebody got fever, people totally became indifferent. They were neglecting. They were just avoiding the people, even close people. They were avoiding, and all kind of human feelings, where they had gone during that time. Nowadays, people are realizing that it's okay. We can be close enough, and we can take care of our people. But in the early stage, it was quite an indifference was there, and maybe that was why sepia was selected.
Okay.
I just got the message that methylene blue injectable was given oral, not potentized.
Oh.
Yeah, interesting. But then the next questions are, any experiences with gelsemium phosphoric acid and China muriatica.
Not China muriatica, but China ars. China ars.
China ars. From muriaticum or
Acidum
zincum
phos,
muriaticum.
yeah. Acidum phos definitely
Okay.
more when the weakness in predominant and the depression and all this, definitely. And Jasemium, yes. Jasemium also. If you have the typical weakness, we have also quite a few patients here that just have headaches. They just have headaches and some fever and nothing not. We have other one isolated thing. We have patients that just have really problem with nausea and headaches and otherwise nothing or almost no fever. So it depends. In such cases, Jasemium is also helping a lot. Yeah.
Now I got the word that sepia spray is banned by authorities as there was no study to support it. And I can remember talking to, was it Peter Tominello or John Gamble in Australia, who used China arsenicosa in the very early stages in March. They found it very often. That I can remember. So people are highly interested, as I see in our conversation, and they are already asking that they want to learn more. They just want to hear about cases and case evaluations and how to prescribe quickly, as it is such a changing thing. This seems to be the focus of interest.
Yeah, I will share one experience of treating ICU cases, where particularly patients are on ventilators and you cannot put your remedy in. So rubbing on the skin, the tincture of the remedy, directly rubbing on the skin, on the ear lobes, just like this, has we have seen results in few cases, not in all, and it needs to be studied properly. We know olfactory inhalation or instilling into the mucosa just by doing this and putting under the lip, that can also give rise to the good effects. But I have seen just doing rubbing the tincture on the ear lobes, or if you want on the chest or on the hands. So if you see the travel time of a blood from one part to another, I don't remember exactly, but it's very few minutes, I think 1 or 2 or 3 minutes. The whole body's blood flows from one part to whole of the body. And I forgot the exact time, the circulation time. And from that, I realized, yes, it works. And sometimes just rubbing on the scalp also can.
Doctor, you're talking about the case you're giving mother tincture?
Not mother tincture, the potentized.
Okay. Just the potentized medicine in liquid.
Dilution.
That's in dilution, yeah.
Dilutions. And because we are not getting an access to the tongue because patient is on the ventilator. And at the last stage, I would add again, because I've treated many ICU cases also, where I was allowed because I get an advantage of being an allopath and homeopath. So I can interact with them, and some people, those doctors known to me, they allow. And therefore there I have seen that particularly in the cases where patients are on NORADs, when the BP is down and it is maintained, the vital force is almost negligible. He's on the verge of death. There we should never give any potentized remedy internally. It's because dynamic vital force is almost between 0 to 10 scale, I would say, and that would not accept that dynamic potency. It's my personal experience. I do not know what others have to say about it, but there I advise not to give the potentized remedy on the tongue or by olfaction, but just by rubbing and see the change.
Yeah, but lower potencies can be given, I think, because 3 potency.
Lower potency, that too by rubbing.
Yes, by rubbing.
At the most, you can try, if you are very sure about the remedies, LM potencies.
LM potencies. Because we had done during my husband's time, we had given that in lower potencies, and his oxygen levels also improved. And but later, due to some other reasons, then he couldn't survive. It was the thing. We tried lower potencies. And I have started one course that is the first aid course. I'm taking a first aid, emergency medical conditions, and CPR. I started a small homeopathy and role of medicines, homeopathic medicines. So simply to make aware of the people about importance of homeopathy in such emergency medical conditions. So at least as a first aid, they can give the homeopathic medicines. They can include those homeopathic medicines in their first aid kit.
Mm-hmm. And I started, I called it a homeopathic refresh. This is the name, and I do it once every week or every 2 weeks. And there I report about the cases about the COVID cases also, not only, but about the cases that we are having in our clinic, also the cases where we are encountering problems, where we don't find the medicine straight away, where we are struggling, because let's be frank, it's not always bing. No, sometimes it's a bit difficult, and but it's all in German, so it's not in English.
I'd like to share one more thing. I'm a task force member of Government of Maharashtra here under the chairmanship of Dr. Padma Shri Dr. T.P. Lani. He is an ophthalmologist, but he is a chairman of an Ayush task force. Ayush A stands for Ayurveda, Y stands for Yoga, U stands for Unani, S stands for Siddha medicine, and H stands for homeopathy. So it is AYUH. And the task force which is being formed, and the Central Council of Homeopathy of India, that is Government of India, Dr. Anil Khurana, and in Maharashtra, Dr. Kuldeep Kohli. And our coordinator, Dr. Kuldeep Kohli, is an Ayurvedic doctor. He is the Director General of State Ayush Task Force. And Dr. Rajeshwari Rapata, she's a gynecologist, but she has got a lot of interest into alternative therapies, and she believes in that. She's a main coordinator, and a wonderful group has been formed of Ayurvedic physicians, homeopathic physicians, Unani, and acupressure doctor is also there, yoga and naturopathy. And we have come out with guidelines. That is, first advisory was for prevention. Second advisory was for treatment part. Mild to moderate cases were allowed. But I tell you, if the Ayush medicines are used as mild to moderate cases, people will not go into the deadly states of hypoxia and going on a ventilators. So Government of Maharashtra was kind enough to give that permission to form a task force. And I, being a member, I know that how hard we are working to give the guidelines. And we have framed accordingly what was started of this emergency kit. We have framed every medicine, few important symptoms. So even a patient can read that instructions, but he should follow that with the homeopathy doctor. But at the time, suppose at night time there is emergency, what he should do, so that when he reaches a doctor, by that time the time will not be lost and patient will be in a better condition. So we have wonderfully planned the advisory too. And third advisory that we are coming out is with even with the serious cases of an ICU and post-COVID cases that we are planning. The wonderful guidelines have been given. It has been published and circulated all over India from Maharashtra, and other states are also following, like Gujarat, Haryana, and some states still have opposition for homeopathy. But gradually it will come up, and our team is very good. And Dr. Jawar Shah had taken integrative approach webinar, you must be aware, and he is one of the task force member. Dr. Naveen Pavaskar is our homeopath, who is a research officer there. He designs all the research projects. And now we are going to come out with one of the research trial, where we will take 2 remedies of most strongly indicated remedies of homeopathy, Ayurveda, Unani. And acupressure, you can just press this finger, 2 fingers, to stimulate your lung functions. And combination of that, we would like to see what happens in the patients who are admitted and how good it will be to prevent and save their lives. So our Maharashtra Ayush Task Force is doing a wonderful job, and our leaders, respected our Dr. Lahani sir and Dr. Kuldeep Kohli and Madam Rajeshwari Rapata, they are helping together form, and they are supporting Ayush from their heart and convincing allopaths also to agree. It's difficult, but a day will come when everyone will understand. Corona has brought all of us together to think. Don't fight. United we stand, and divided we lose people. It's life. So we have to think seriously.
This is wonderful, sir. The task force is doing a great job. But I also think that people, homeopaths, who also swallow some allopathic medicines, and some conventional doctors also who are using homeopathy, both of them should come together and tell people about the importance of each other's pathies. And recently, news had come yesterday itself about the COVID-19 patients who had turned to Ayush. You know, the Kerala government had given some Ayurvedic and homeopathic medicines a scope, yoga and all, where patients were given scope to get avail the benefits. But later on, the secretary, Ayush secretary, was sacked or something, like fired or something done against the secretary. The news was there in yesterday's Indian Express. COVID-19 patients turn to Ayurveda for cure, and Ayush Secretary of Kerala faces wrath of practitioners. So now, what has happened there in Kerala? Like, what is the situation? Why the government is not allowing the Ayush medicines to be given to the patients? Because it's a patient's birthright, you can say. It's a right of the patients to get whatever treatment they want, isn't it? So as Maharashtra patients are getting their medicines, hospitals are also now introducing, because of the task force. In a similar way, it should be gaining much more approach, and patients should get their right of the treatment, whether it is Ayush or whether it is allopathy or whatever. It should be, because it's their faith, and faith is what heals along with the medicines.
I agree, Dr. Rajeshwari, because Maharashtra was the worst affected state in whole of the India. Maharashtra was the worst affected state in whole of India. And
Yes.
after Ayush Task Force came into force, action, and we formed the guidelines, and we opened the hands of homeopaths, Ayurvedic physicians, and other practitioners to give as an adjuvant to an allopathic treatment, not take over that, with the consent of the patient. If the patient gives a consent, you cannot deny. The picture has changed here. We have formed immunity clinics. Dr. Lahani sir has framed a very nice immunity clinics. Dr. Kuldeep Kohli and Dr. Lahani sir, they have said we must have immunity clinics. And then we started working on immunity clinics. So every street, lane, doctors who have got clinics, we requested them to change into immunity clinics. If the immunity is improved at the first stage, even if it mild symptoms patient comes, we know that how homeopathy works. It improves physiology and immunology to fight against a disease which body is weakened or cannot fight. So even those approaches have brought down the cases in Maharashtra quite well. Otherwise, it was a worst affected state, and now it is best amongst all because of introduction of homeopathy, Ayurveda, and Maharashtra Ayush Force, what work they have done. It's really commendable job that all of our task members have done, put in the intellectual inputs. Only things what is required was a time and acceptance. But gradually we can convince the allopaths also, and they are also understanding. They are also cooperating now. The notice has been put and given to all hospitals and this, that please do not stop people from taking homeopathy or Ayurveda and Ayush medicines.
I have a bit of a problem. More and more questions are coming in, but our time is already quite over, I think. Let us close this discussion on post-COVID syndromes, which is the main question which is coming through. And maybe we can meet another time in December or so to discuss for a second time and get the next questions, because there will be more and more and more, and people really like to know. But maybe each of you can give a comment on post-COVID-19 syndrome.
Post-COVID-19 syndrome is a very big topic.
I know.
I have prepared whole of my PPT with 140 slides. This is such a big, you cannot talk in short, but I would say that post-COVID, immediately if you start we get time there, we cannot hurry up, hush up, and go by individualization, giving proper organ remedies for if the fibrosis has been formed, because that needs to be dissolved. Along with the individualized remedy, it will cause wonders, because the time is short and we have already crossed the time limit. So we will have a separate session for this, because it's a very big topic. We cannot talk in short, but in a broad sense, I would say individualized remedy with the pathological remedy 6C potency will make a great difference and wonders, because we need to see the pathology also going down. Just patient feeling fine and pathology is not, it may give rise to problems later on. So it's a very big topic and we will discuss, I think.
Another time.
Martine, if you want to add something, you can add.
No, I agree. This is first of all, our experience is growing by the day, so it's one point, and it's a huge topic. So I agree. But also the way you said, individualized medicine, which is of course depending of the whatever are the problem, because post-COVID is not. It's really a huge diversity. As the disease is, the post-COVID symptoms are as various, as different as tubercular as the disease itself. So we have to go for this, and I think that everybody has to really document very well all these cases very well, and then we will learn from each other.
That's true.
So what I think is post-COVID-19, the second wave, if it comes, two extremes can happen. One thing is people who will turn rebel and go out and do whatever they want. And second thing is people who will be totally scared. And again, the same thing as it happened in the early phase of the COVID-19, stocking up things and closing the doors and staying alone. And these two extremes can happen. And this is the time actually where people should be made aware of all the different kinds of medical conditions, especially emergency medical conditions. And the task force, I think, as Sir told, that the advisory is making the emergency medical list and all the things. So this should become a national campaign, and every person should be made aware of all these emergency medical conditions and the important homeopathic medicines which can be given during these times, especially for the lay people who don't know anything about the medical conditions, what will happen if they go to the hospital. So all these things should be made aware to the people. Another thing is the knowledge of CPR, cardiopulmonary resuscitation. In the European countries, even the school children, they know about the CPR. Only in India, people don't know about it. So I think that this should be made aware to each and every lay person. Each and every school child should know about CPR. So this is the course actually I am designing, but if government takes initiative in this, I'll be more happy.
It's a very nice course, and that is a need, because many times someone falls unconscious in the house. What you should do first? If you don't know CPR, that is cardiopulmonary resuscitation, just a thump and put on a chest thak. The mechanical shock can also start the heart. This is a small tip I'm giving, which now doing the cardiopulmonary resuscitation, Dr. Rajeshwari is doing a right job of training and taking this should be supported. And once we get that training, many lives can be saved. But just a thump on a chest with the force. The mechanical shock can start the heart. That is what I have seen.
If I may just say, just to as my last words for today, because I think, you know, one of the post-COVID problems that we're going to face, that I think we're going to face, is this infection with the fear of death and the fear of the name of Corona. It is deep into the brain of everybody, and this is a very big problem because, as we know, fear is a very bad companion for good health.
Correct.
And we will have like direct medical, let's say physical problems post-COVID, but we are facing a lot of other problems. And this homeopathy has to play a big role in this, and we can help definitely people to accept death as a part of life. There is no life without death. It is the game, and this is the game we have to go. These are the rules of this life, and it would be also a good idea to, when this ho-ho-ha-ha of COVID is gone, that we talk a little bit about this also, and reflect what the heck did we did on this planet. How did we react to this situation, which is a very poor, how do you say, results, you know, of a very low spirituality in humanity. Because this is so just fear, dying, death is the worst. My God, death is a part.
Homeopathy has a wonderful answer for that. There is a rubric. Yes. Ailments from fear of fright remains.
It is a huge rubric, and we have a lot to do to individualize.
Yeah.
Good.
Yes, but as Martine said, there's a lot beyond matter. There's a lot to talk about, the things beyond.
And this is more scary than the virus.
Yeah. So thank you very much for this talk today. I personally enjoyed it very much. May I ask you listeners to subscribe to our channel. Please spread the word about our channel. And my dear colleagues, I'd like to invite you again, maybe in December or January, to talk about post-COVID-19 syndrome.
Always there for you, Marianne.
Oh, that's good. That's good. So thank you.
Maria is doing a great job of uniting and bringing together all the homeopaths of the world together and letting people know that the importance of homeopathy is great.
Thank you. Thank you so much.
I thank you.
Thank you so much.
Thank you.